Jones. I'm a dermatologist down in Brattleboro, and I'm the Vermont State Director for Doctors for America, a group that supports reform. And I have a quick example of a tragic case, but I also wanted to talk about physicians. I think what's not lost on any of us, I'm sure, is that it's the poor who are sick. And if that's true, and that means they can't get health care because they can't afford it. So single payer is the only solution to that. My case is a patient with multiple myeloma. He had worked his whole life. He was a professional and was retired. And he had to spend his life savings on his cancer treatment. And so he had nothing to give his children, and he actually shared with me that he felt like committing suicide after all of this care because he had nothing left to give his children. And that's just tragic, and it shouldn't happen. But I also wanted to give the example as a case study of all the physicians who are my colleagues who are working so hard because they are getting more and more ill patients that they have to take care of, like diabetics and obese patients and such, that they can't cure. And so they're working harder and harder against the insurance companies. We have these billing companies that we have to pay a large portion of our income to just so that we can get paid by our insurance companies. And then we have all the other struggles with pharma, et cetera. It's huge pressures. And a single payer system would address all that. So that's why I support single payer.